But you might ask, why a women's center? Why do we need a women's center? Women's health care is actually different than men's health care. Women actually have different disease processes that are completely different than what men do. For example, women have certain diseases, makes sense, that men don't have. They have certain kinds of cancers. They have uterine cancers and cervical cancers. They have certain diseases that happen more frequently in women than in men. Breast cancer, for example. They have certain diseases that behave differently than they do in men. Cardiac disease. You've heard that before. Cardiac disease and a heart attack in a woman is not the same animal as it is in a man. So if you have a group of professionals together who understand this, then they can treat our patients better. They can tailor their care. They can really understand what's going on. We all benefit from that. Okay. So that's one part of it. Another part of it is that if you realize that women use a larger portion of healthcare resources than men do, then women make the larger portion of healthcare decisions for their families. And the women know that. Yes. You know, there's that old phrase that says, when mama ain't happy, nobody's happy. Okay? We want mama to be happy. We want mama to come here and have her care with us. She's trying to decide where to have her gallbladder taken out. She's trying to decide which sleep lab she wants her snoring husband to go to. She's trying to decide where to take her kid when they have an asthma attack. We want her to come here. So this is going to help us accomplish that task. We want her to bring her family with her, maybe not at the same time, maybe not in the middle of the night, but we want her to come. So again, the Women's Center is going to really help us accomplish that task. Probably the easiest way for me to describe what we're thinking about with this center is to kind of walk a theoretical patient through. Now, I'm going to also talk about radiology. Women's Center is supposed to be on this side of the building. Women's imaging is going to be on this side of the building. It's going to be fantastic having them close to each other. It's going to be a very, very good working relationship. And radiology has done a tremendous job at figuring out a new patient flow. This has been one of our biggest issues with our breast cancer patients. How do these patients flow? How can we make it as streamlined and easy as possible for them to? Somebody goes for their annual mammogram, one of two things is going to happen. They're going to have a normal mammogram. They'll be notified, this is the system the way it is now, notified either by a letter from radiology or by their primary care, whoever ordered that mammogram. That could take days to weeks. Okay. Or they could have an abnormal mammogram that might require some additional imaging or maybe even a biopsy. The setup for that could take days to weeks. Separate appointments, multiple appointments, consultations, a lot of uncertainty, a lot of worry, a lot of anxiety. Radiology has worked hard to try and fix this process, but doing it within confines of the system that they currently have has been very difficult. Starting brand new with this new women's imaging, it's going to make it much easier, and they've really put out a nice plan. What's going to happen now is that the person has a normal mammogram. They're going to walk out of this facility on the day that they have their mammogram with a letter in their hand that says, it's normal. Think about that. You know on the day that you have your mammogram that it's normal, and you don't have to worry about it until next year. Okay? So that's a huge, huge thing. If they need additional films, if at all possible, and they're going to make it possible, those films will be done on that day. Don't have to go back. You might even be biopsied on that day if it's appropriate. If it's not appropriate, you will not leave that facility until you have an appointment made for the next step, whether it be additional films or the biopsy. That's huge. In addition to that, they're going to have a list in radiology of the primary care doctors who are willing to relinquish control over this process, meaning the radiologist can make these decisions without having to call the primary care's office for permission. So radiology doesn't have to stop in the middle of what it's doing to call the primary care's office, to stop the primary care doctor from whatever it is that they're doing, to fill out the paperwork, to fax it back to radiology, and then proceed. Think about that. That's amazing. Okay. The other thing the radiologists are now going to do is if they do a biopsy in radiology, they are going to give the patients the pathology result. They've never done that before, and it's a huge commitment on their part, and we definitely appreciate it. But again, this will help to streamline the process for our patients. They won't have to wait for somebody to call them days later. So everything is meant to decrease the anxiety for our patients, to make them go smoothly through the process. Before I move the patient from here to there, radiology will also have bone density for osteoporosis screening, access to CAT scans and MRIs, ultrasound for pelvic ultrasounds, breast imaging. They'll do everything that they do now, but just more efficiently. It's going to be very nice. So let's say our poor theoretical patient has to see a breast surgeon. They can either see Dr. Ball, our new fellowship trained breast surgeon, in the Women's Center. The breast services will be the anchor for that center. Or they certainly can see any of the other excellent surgeons in our community. The patient will move from radiology into the Women's Center with the help of a navigator that radiology will have. They will have their own patient navigator. Okay? Radiology is committed to owning these patients, taking them through the process from beginning to end. And we think that's a great thing. Breast services will also have their own navigator that will help this patient make their appointments and coordinate their multidisciplinary care. Oncologists, radiation oncologists, the support services, all of that will be done. So the only thing the patient has to do is to concentrate on getting better. So the patient will see the breast surgeon, the surgeons, the plastic surgeons, whoever they have to see, and get their care. So we're trying to make this as easy as possible. So that's the majority of the flow from radiology through to the breast side. And we are incredibly excited about that because we know this is a large portion of what women's centers do, and we want to do it well. The other services that will be provided in the Women's Center, because in addition to the breast surgeon, there will be some other office space. I call them pods, because they're kind of their own little entities. They've got waiting areas, they've got their own exam rooms. We can have other physicians there who will provide women-oriented care, whether they be urologists, gynecologists, gynecologic oncologists, the plastic surgeons, the medical oncologists. And they don't have to be in that space permanently, they can rotate through that space. We can have consultants, pharmacists who do compounding and bioidentical hormones, dietitians, rehab. Rehab is really important in this because there are certain conditions that rehab can work on with women that are very specific. Osteoporosis, lymphedema after mastectomy surgery, pelvic floor disorders, incontinence. The list goes on and on. Rehab will have a fairly large footprint in this facility. So women can access different kinds of care through the Women's Center and have their needs taken care of. We also know that the way that the center is going to look is extremely important. It's important to sync the physical plant with the concept. We want a special facility for a special service that we're providing. And everybody knows that just certain environments feel a certain way, and we want to make sure that we address those needs. We want it to be comfortable, healing, welcoming, and all of those things are done with the furnishings, the colors, the lighting, the nature aspect to it. These things are important to us, and we have a subcommittee that's going to be working on this with the architect and the interior designer. So that when you walk in there, you go, nice. Okay? Very important. So we're working, we're moving forward with this, and we want you to be excited about it because we're excited about it. And you've done a lot of work, and you've put in your time and your effort and your money, and we appreciate that.